sort of fear complex, that is Biruna. And
which is going to help us in understanding or the perceiving of the knowledge. Right? If you look at the Avasthanusara, we find that Lakshanam, Manaso, Jnanasya, Bhava, Abhava, Evacha. So, especially in Charaka, Avasthanusara. Right? So, basically, the one which helps us in the understanding of knowledge or understanding or not understanding of the knowledge, the entity that is responsible is Manas. So whenever you have a proper Jnanapati, so that is why Atma Manasa Samyuchite Manam Indriya Trena Tatha Jnanapati. So the Jnanapati to occur, there should be a proper perception of the objects, then understand the basic concepts, we go to the literature, and then we go for the clinical application. That's what in next few minutes we are going to talk about the basic concepts of Manas and Manasika Yogas. Then what are the various literature that we find related with the Manasika Yogas, and what are the basic line of treatment that we commonly follow in case of the Manasika Yogas. Because just Unmadha is a very ideal example for understanding everything. Like whether we are talking about the Trividha Roga Karanas, how we apply the Asatmya Niyata Sayoga, Prajna Parada, Parinama, okay, Parinama application. So we commonly see that whenever a patient comes to you, comes with a condition, like there are some conditions which are based on some age, like age-related condition, like there are some exclusive for like young age, mid-age, old age. There's also like there are few things which comes in the morning, which comes in the evening and night. There is a diurnal variation of the psychological manifestation. There are some diseases which comes based on the seasons. There's something called as seasonal affective disorders. Like there are some diseases which are increased in summer. There are some psychological disorders which are diseases which are dominant in the winter. There are some which is called as SAD. Seasonal affective disorders. So the season or Ritu also will have an effect on the body. Okay. At the same time, you might have heard that the patient, suppose there is Amavasya or there is Purnimi or there is full moon day, the symptoms of psychological disorders will aggravate. No patient say that. No? Very commonly, many people say that I see that these symptoms really flare up when there is a particular, and this is the influence again of Parinama on the clinical manifestation of the various psychological disorders. So ideally, to know about the Trividha Roga Karanas, Unmadha is a very good model that we can always understand how we understand the Trividha Roga Karanas and how do we apply. The same thing is in terms of the, see, basically when you say that it is one of the Ashtanga Ayurveda, they should say, to say that it is one of the Ashtanga Ayurveda, there should be sufficient Hetu, Lakshana and Chikitsa. Only those set of disorders which has sufficient information in terms of the Hetu, Lakshana and Chikitsa will be given the status of a branch. Otherwise, if there is only, see, hardly there is, we say that in Manasa Yoga there is Unmadha and Apasmara, and that too, that is a component of Kaya Chikitsa. Then what is that? If nothing is there, then probably it would not have been given a status of a separate branch. So what are the content of this? So that's what we are going to explore. And very importantly, this is also a very good model. Unmadha is also, I said, Unmadha is a very good model for understanding the Trividha Roga Karana. Unmadha is also a very good model for understanding the Lakshanas. Like as I was mentioning, the Samana Lakshanas and the Vishishta Lakshanas. Okay, there is Samana Unmadha Lakshanas and Vishishta Unmadha Lakshanas. And also, Unmadha is a very, very good concept or very good model for understanding Nija Roga and Agancha Rogas. Just as we have in Jwara and Anya Chikitsas. Again, this Unmadha is a very, very ideal model for understanding the basic difference between a Doshija Unmadha and an Agancha Unmadha, or Nija Unmadha and the Bhuta. And very importantly, Unmadha is also an ideal model for the application of Trivida Chikitsa also. Like, what are those conditions where we apply the Parishad Chikitsa? What are the conditions where you apply the Parishad Chikitsa? And what are those conditions where we can apply the Sattvaja Chikitsa? See, if you look at the sequence of or the order of the Charaka Chikitsa, like how the treatment is being mentioned. See, we do not find that directly they start with Sattvaja Chikitsa. We say that for Mansika Rogas we should do the Sattvaja Chikitsa. But that is not the context in case of the Unmadha Chikitsa. It always starts with the Yuktiva Parishad Chikitsa. Shodhana is mentioned. Then we have a lot of Shamana Aushadhis, Grita Prayogas, especially like Kalyana Grita, Maha Kalyana Grita, Apara Lakshana Grita, Kirtsa Grita, Parishad Grita, and very important the Purana Gritas, the Purana Grita Prayogas. Then comes Yuktiva Parishad Chikitsa. Later on we get the Deva Parishad Chikitsa. And then later on we get, so that's itself is the Avasthanusara application of all the Trivida Chikitsas. So we have the application of Yuktiva Parishad Chikitsa, you have the application of the Daiva Parishad Chikitsa, we also have the application of the Sattvaja Chikitsa. And that is what is mentioned. So ideally, Unmadha is not just a disease complex, it is not just a psychiatric disease model, but an ideal model to understand the clinical application of Trivida Roga Karana, to understand the Lakshana, and also the application of the Trivida Chikitsas. See, if you look at the very first chapter of Charaka Samhita, Sutra Sthana, where he talks about the Sharika doshas and the Mansika doshas. And after he mentions about Vata, Pitta, Kapha, as well as Rajas and Tamas, he mentions how do you manage these conditions, how ideally you need to treat these conditions. It is from Charaka Sutra Sthana, first chapter, Shloka number 56, which mentions as Prashamyati Aushadam Purvam Daiva Viktiva Pashainihi Manaso Jnana Vijnanam Dhairya Smriti Samadhi. So ideally you treat the Sharika doshas with the Viktiva Pashaya, Daiva Pashaya and other modalities of treatment. And for the treatment of the Mansika Rogas, you follow different tools and techniques mentioned as Jnana, Vijnana, Dhairya, Smriti and Samadhi. Right? So what are these? What is this definition? What are its clinical applications? What are the outcome of these techniques? So we are going to talk about this. So in my opening remarks, I will say that Unmadha is a very broad concept, a very broad approach for how do you approach to a patient of Mansika Rogas, how do you examine the patients, how do you do the mental status examination also. If you look at the commentary for Charaka Nidana, like what Sir was mentioning about the different Unmadha, Punaha, Mano, Buddhi, Sanya, Jnana, Smriti, Bhakti, Shila, Cheshta, Achara, Vibhrama, Vidya. So each of them, how do you examine? How do you examine clinically? Itself is being described in the Chakrapani Tika of Charaka Nidana 7th chapter, which we are going to talk. Right? And also the Trivida Roga Karanas, the differentiation between Nija and Agamtuja Karanas, and the application of the Trivida Chikitsas. So with this opening remarks, I now request Joshi sir to moderate further.
Any doubts or questions? Any questions?
So this is tadvidyasambhasha parishad. Should not be udasina parishad. Should be suhrat parishad. Should be more interaction. It appears like udasina parishad. Should not be, no? In the parishad.
See, if you have any doubt related to the psychiatry and the Unmadha in Ayurveda, the extraordinary scholars are sitting. You clarify your doubts now only. Again, you will not get this opportunity.
सर आपने आत्मादिनाम च सर्वेशः बात कही है तो आत्मादिनाम च सर्वेशः आपने कहा है चिकित्सा में, तो उन्माद की चिकित्सा में मनोविकार होता है तो हम पेशेंट को कैसा समझे या हम क्या करें? आपने समाधि आदि बोला है, समाधि ध्यान, तो आप पेशेंट में क्या करते हो और हमें और क्या करना चाहिए, ये सवाल। दूसरा एक सवाल ऐसा है कि आपने वमन आदि कर्म भी बोले हैं, तो स्नेहपान हम करते हैं, तब स्नेहपान करते समय जो हम उपचार बताए हैं, उच्चय भाष्य जो भी कुछ व्यायाम वगैरह, तो उसका पालन उस पेशेंट में होता है क्या? ऐसा दूसरा प्रश्न था। और आपको एक प्रश्न है, ये था कि आपने निदान के बारे में बताया, लेकिन स्टार्ट करते वक्त आपने जप होम हवन आदि चिकित्सा बताई सत्वाव जैसे, तो तो उसका कार्यकारण अवसर ने भी दान ऐसा भी कहा था, तो उसका कार्यकारण भाव क्या है कि क्या कैसे होता है?
देखो, आत्मादिनाम च सर्वेशः आप दो क्वेश्चन पूछ लिया. The patient is not the patient with Unmadha. Of Agantuja Unmadha, definitely I told you, the Vibrojana Unmadha is very difficult to treat. What's told some modern correlation. It's not correlated. He also told that you should not correlate the bipolar disease or schizophrenia to this Vibrojana Unmadha. Even though there is some correlation of these diseases by symptoms and other what we see in present era. See, first of all, we treat with all the techniques. When the patient will come with us, we should not tell him, you have to realize yourself. If you tell, he will not understand. That question is right, what you have asked. When the first day he will come, you should realize yourself, then only you will become normal. If you say, this is not a treatment, you take the history and then you have to examine properly. Then what is the problem? What is the cause behind it of this Unmadha you have to find. First you have to treat the cause here. Why the patient developed this problem? What is the history behind it? According to that you have to treat him properly. If he requires any Aushadhi Chikitsa, give him Aushadhi Chikitsa. Sir told rightly, there is a relation, Sharira and Manasa. For a Sharirika Vyadhi also, for Sharirika imbalance of dosha also, the treatment is required. According to the dosha involvement, you have to do the Vidyopashraya also. Then the Devopashraya also. If they have, so Jyotishi is what they told, sir told. Some they are telling that you have to perform this, the home, havana, etc. or you chant this mantra or etc. what they told. That is also correct. You have to tell him. When he go on practicing this by along with your medication, when he will come to your in that level, understanding level, when he will come, stage by stage it will come, not by immediately. Avasthanusara Chikitsa it is. Avasthika Chikitsa. When this avastha the patient will reach, the buddhi has become to a normal state. Sir told the prasanna atma indriya. When his mind is prasanna, okay, he is able to understand what we are telling and he is able to adopt the things, the physician what he is telling, he is try to understand, try to adopt in his life. Then you tell him Atmadinam Tasavasha. This is the last part they told by Acharyas. Before that they told the Vidya Seva Vidyanam. That you have to tell what is tadvidyasambhasha. You go and do service to the elders. No, he will not do. But what is the benefit of doing this? You have to realize, you have to tell him first. You have to educate him. If you make the offering to the elders, or if you make the save of the elders, what will be happen? You give the example, give the concept, they show the pictures, showing the others what they have benefited with this by giving the history. With the help of history, you have to tell. Then he will start understanding, oh, I have done this because of this, I am getting this problem. I should come out. When he will become in this state, then Atmadinamcha Sambhasha. Finally, you have to the Atman self-realization, that will be final. Not first only the Atmadinamcha Sambhasha. Very sense.
दूसरा एक पंचकर्म के बारे में स्नेहपान जब वमनादि से हमें चिकित्सा करनी बोली है आपने दूसरा, तो उसमें हम स्नेहपान करते हैं पूर्व कर्म के, तो स्नेहपान के बारे में जो उपचार बताया है स्नेहपान समय अव्यायाम उपचय भाषण जो नहीं करना है वगैरह, तो उसमें उसका पालन होता है क्या पेशेंट? होता है. Patients come with this when he will be admitting in the patient, admitting in the hospital. We have to give the instruction. See, patient along with when we are doing the Nityopashaya, the patient attendant is also very important. We will not take history from the patient only. We will take history from the patient relatives. Isn't it? In psychiatric disorders. In the somatic disorders, patient will give the history. Whereas in psychiatric disorders, patient relative and friends and other, the nearest and dearest, they are giving the history of the patient. That will be more authenticated. But what he will tell immediately in first round only, we should not believe what he is telling. Isn't it? Gradually when he will become a normalcy, then you have to ask him. This Panchakarma what you told, Snehapana or the Basti or the some Shirobasti, many patients they will deny. For this also they will deny. Hey, I don't have any, I don't want this treatment, I will not get this relief, I have this one. They will tell. But you have to convince. In what way, in what is his level, you have to convince him. See, not for your psychiatric problem or if you have this problem, we are treating him. So you tell some other problems to him, you have to give. Isn't it? Woman, why you are giving? Shirobasti, whatever. See, you have some problem with the headache and other things. For headache and we are treating. This Snehapana for your appetite and other things we are treating. What other associated symptoms he had, you have to tell him. For psychiatric problem only we are treating, patient will deny, he will not undergo the treatment. In that you have to convince the patient and then you have to allow the treatment.
Yeah, explain this question. Because see, Daiva Chikitsa, Daiva is, you mean by Daiva? Adrishtena hetukena. There is no drishta hetu for the Daiva. Daiva Adrishtena hetukena. So, here, what do you mean by Prabhava? Draviguna, Prabhava. What do you mean by Prabhava? Achintya Shakti. So this Daiva Vyapasthaya is also a Achintya Shakti. Maybe by doing this mantra, bali, havana, mangalya, upahara, gamanadi, all these have their own effects on the physics and mind. That effect will cannot be measured. Okay, so Daiva Vyapasthaya, by going to the particular temples, particular places, even in the mosque, church, all these, patient get benefited or they become normal. They won't have any symptoms. Your Yuktayopashaya, after doing Vamana, Virechana or giving 10 medications also, patient sometimes not get benefited, but by simply going to that temple or by simply performing that havana, patient will be completely alright. How this happens? There is no measurement for that. But the patient get benefited because of the achintya shakti of the Daivaparshaya, and also he himself treated. Okay, this is what happens in Daivaparshaya Chikitsa. Because person, if he decides that okay, I get benefited, I should get benefited, if the inside is normal, even if the inside is not there, then also this Daivaparshaya Chikitsa give benefits. That is what achintya shakti of this Daivaparshaya Chikitsa. It cannot be measured. Now, by some instruments, this mantra shakti are measured. The effect of the homa havana on the environment is measured, and by doing putra kameshti yaga, where the many specialists, that infertility specialists rejected case, this cannot be done from us, that they have conceived, and many psychiatric patients get benefited. So that is the achintya shakti of the Daivaparshaya Chikitsa. That's why Charaka has mentioned or given prime importance to the Daivaparshaya Chikitsa first. He has mentioned Daivaparshaya Chikitsa first, not the Yuktivaparshaya. Because definitely Daivaparshaya Chikitsa will have effect on the body and mind. Yuktivaparshaya may or may not, but this Daivaparshaya Chikitsa definitely will have. But Yojakas Tattva Durlabha, advisors is not there. This particular person should do this particular puja, this particular upahara, this particular bali, this particular, that aspect we missed the link. We are not, because earlier the Vaidya used to learn along with the Ayurveda, Jyotisha, and these Vedas also. This Upaveda, along with that they used to learn Veda also. So when we learn Veda, these all Daivaparshaya Chikitsa will come first. And when we forget that, only we are dependent on Yuktivaparshaya now. That too, Yuktivaparshaya with limitations. Because that Daivaparshaya is having achintya shakti, achintya virya, achintya prabhava. Okay. So that's why in all aspects, when we start doing some new works, all Daivaparshaya Chikitsa we do. Bali, puja, homa, why we do otherwise? If it is not having effect, why should be done? Is it not? So that Adhyatma effect will be there on the Atma. Adhyatma, apart from the Atma, that effect will be there. So that's why even in many diseases, this is mentioned. Along with the Yuktivaparshaya, if you do the Daivaparshaya Chikitsa or if you advise, the benefit will be more. Patient will be alright immediately. That's why in all the chapters you will get the Daivaparshaya Chikitsa. Okay. That is the first line of treatment should be, but we forget that. We now left it to the pujaris or the purohits and jyotishis. So they are earning with that. The Ayurvedic Vaidyas has forgot the important aspect of treatment. Not in psychiatric center. Even in many physical diseases also, the Daivaparshaya Chikitsa is having prime importance. I had seen several physical diseases, which we consider as physical somatic diseases, where after doing this particular Mrityunjaya Homa or Rudra Havana or etc., the patient get benefited even from the cancers. Okay, so Daivaparshaya Chikitsa is having prime importance in the treatment, which maybe you learn and continue in your treatments to your patients. Okay.
To add to what Joshi sir and Narayan Prakash sir has mentioned, There are two basic concepts like I would like to bring here. One is how do you examine such patients who come with psychological disorders. As I said, the assessment, how do you assess the patients, which is called as the mental status examination. That we get from the Charaka Nidhanasthana 7th chapter. Unmadha Punaha Mano Bhutti Sanya Jnana Sthiti Bhakti Shila Cheshta Acharitam Vidya. And we go to the commentary, the Chakraparti Tika of the same shloka. They mention how do you examine such patients. Right? Like for first is the manas. Basically, you have to understand so whether he is Priya, Apriya, Nitya, Anitya. If your patient is able to differentiate this and then do the assessment, that is how we examine the manas. Buddhya is whether a person is able to differentiate between the Chintya and Achintya, Priya, Apriya things, then basically it's able to discriminate between what is right and what is wrong. What he should do, what he should not do, what he should accept, what he should avoid. All this basic ability to differentiate things comes under the Buddhi Pariksha. Then you have the Sanya Jnana. Sanya Jnana refers to the orientation to place, time and person and the responsiveness. Both orientation like Desha, Kala, Atma, Adi, Vijnana. So the Desha, Kala, Atma. First one, the orientation to place, time and person. Right? Is what we examine in case of Sanya Jnana. Smriti, as you know, it refers to the different types of memory, like recent memory, remote memory, immediate memory. Assessment comes under the Smriti. Bhakti refers to Bhakti iti Ichha, like the different desires, because the person will have different types of desires. Okay, Puram Ichham Asit Tatra Anichha Bhavati. So for all those which he was having likings, will not have interest. And I think especially if you look into in the disease of depression, this is symptom called as anhedonia. Anhedonia is all those pleasurable things will not become pleasurable to him. He doesn't know. Suppose he was very much interested in going for a movie. He was very much interested in going for a long ride. He was very much interested in playing music. He was very much interested in dancing. Now no more he likes these activities. This is a very important symptom, which is the Bhakti Vibhamsa Lakshanas. Then we have the other, like Shila. Shila, Sahaja Vritti, like the daily routines that person has, the temperaments, emotions, is like Akrodino, Krodino Bhavati. Like those who are very silent, it becomes very violent. It's a very important Shila Vibhamsa. Then Cheshta. Cheshta, both Vak Cheshta as well as Sharira Cheshta, the speech and the physical movements, and the Achara. Shastra Shiksha Adhikruta Vyavahara, like the social code of conduct as well as the personal code of conduct comes under. So this is very important. Once you understand which of the factor is disturbed and that's why we have to classify the Mansika. Just as we have Sharika Rogas and Mansika Rogas, there is further classification of the Mansika Rogas as Kevala Mansika Rogas, Nanatmaka Mansika Rogas, Mano Adhisthita Mansika Rogas, and Sharira or the Upayashrita Manovikas. So this classification is very important for the selecting the appropriate line of treatment. Right? So whether it is Kevala Mansika Rogas, like Kama, Krodha, Bhaya, Shoka, all these are Kevala Mansika Rogas. Then we have Nanatmika Mansika Rogas, which are because of Vata, Pitta and Kapha. We have Mano Adhisthita Mansika Rogas, like the root cause could be Manasika, like we have the Bhayaja Atisara or Shokaja Jwara. They are all ideally examples for the. Then you have the Ubhayashrita, like the Unmadha, Apasmara, they are all Ubhayashrita Mansika Rogas. So this classification is, so that first of all the assessment of the patient, and second this classification becomes very important. Where do you apply the Yukta Pasha, the Eva Pasha and Sattva? So as mentioned, one of the question was about the the Atma Dinamcha Sambhasha. See, if you look into Avasthanusara Sutras, where he mentions that the Dhairya Atmadi Vijnanam Mano Dosha Aushadam Para. Okay, we have the Dhi Vijnana, Dhairya Vijnana, and Atmadi Vijnana. So, what is this Atma Adi? For which again you get the reference from Tishteshti Adhyaya, Charaka Sutrasthana 11th chapter, where he mentions Atma Adi Iti, Atma, Desha, Kula, Kala, Bala, and Shakti. So these are Atmadi Jnana that we are talking about. Right? Atma, Desha, Kula, Kala, Bala, and Shakti. So these are the factors, these are the 6 factors that are very, very important when we want to counsel a patient. Like suppose you want to do a Sattvaji to the patients, consider the Atma. Atma here not the soul here, Atma the self, the individual that we are talking about. Like Desha, like where from which Desha is, what should be the common do's and don'ts. Then the Kala, based on the Kala, Ratri Kala, Ritu Kala, etc. Then the Kula, no, as I was mentioning about the genetic factors, the family support, because family support is very, very important in psychological disorder. So involving the family and the treatment comes in the Kula Jnana at the time. And then the Bala and the Shakti, the strength and the capacity of the individuals. So what he is able to do, what he should do, what he should not do. So all this based on his strength and capacity. So this is how you try to apply other Atmadi Jnana in patients of psychological disorders and even in the case of Unmadha. Then we are talking about how you apply the during Steyapana and Ashtanga. See, one of the biggest challenge that we always have in treating the psychological patients is that the patient is already on some medications. Most of the patients that come to the Ayurvedic physicians or Ayurvedic Vaidyas, the patient is already on some medicines like antipsychotic medications, antidepressant medications, anxiolytic medications, anti-epileptic medications. Like hardly we get very fresh patients. Like around 70 to 80% of the patients will already be on medications. So this is the biggest challenge, how do we apply the Shodhana and other treatment when patient is already on the medication. So whether we should stop the medicines, should continue the medicines, should taper the medicines. So that is why the knowledge of the modern medicines or pharmacology is very, very important for a practitioner, especially if you are practicing psychiatry. Always have some basic psychopharmacotherapeutics or psychotherapeutic understanding. Psychopharmacology is very, very important to understand which are the medicines that you are taking, how do you try to, because all medicines do not cope up well. Like suppose patient is already on some medicines, you cannot add the Ayurvedic medicines. Like I'll give one example. Suppose patient is on antidepressants. There are many classifications of antidepressants. One of the antidepressants is called as monoamino oxidase inhibitors. And these are patients who should avoid the milk and milk products. Okay. So that's the reason why the patient if already is on monoamino oxidase inhibitors, you should not give any herbal supplements, especially the glutathiones, because the patient will go into hypotensive crisis if the patient is already on monoamino oxidase inhibitors. And you start with, very commonly in Mansika Rogas we start with the glutathiones, but in these conditions you should not do glutathiones. So that's the reason why you should always have a good understanding of the psychopharmacology before you try to treat the patients. Suppose the patient is already on medications and is for a long time, for 5 years, 10 years down the line, you should not stop the medicines. So that's the reason why there are different methods of Steyapana. Like we have Pravichana Steyapana. Different method. I think this is again an ideal model for applying the Pravichana Steyapana. Like by which we can use along with, like suppose you want to, you can use as Ashtanga Hridaya says, Satyosteyapana yogas can be done, where you can use milk or Buddha or Tila and the Girta can be added, and patient can be continued to take the medication. Do not stop the medication because patients can sometimes becomes worse if you stop the medications. But see, sometimes patient will If the patient is having that orientation, he will listen to. Otherwise, just you can start with the external therapies like the Pichu, Dhara, Abhyanga, Sudhya Virechana, etc. can be done, and then go with the other line of treatment. So that is ideally where you can try to apply these conditions. And that to stay, when you are doing Steyapana, the Prabhuta Steyapana Prayoga is told in Unmadha. Like there is Prasyasi Matra, Alpa Matra, Madhya Matra and Prabhuta Matra. And especially Unmadha, Apasmara are the ideal conditions for Prabhuta Steyapana Matra, because these are conditions which gets better with Steya Prayogas. See, two types of Aushadha Prayogas are very, very important in Manasikologist. One is the Steya Prayoga, other is Asana distance. Again, these are very scientific because both of them can cross the blood-brain barrier. So that's the reason why alcohol based preparations as well as lipid preparations, both of them can cross the blood-brain barrier, and that is why most of these therapies or treatment that has been mentioned in the chapter of Unmadha are either Grita based or they are Asana based. Then which is appropriate or ideal for its clinical applications. So these are a few things that I'm trying to add what Sir has.
In addition to examination, in Vimanasthana 4th chapter, after explaining Pratyaksha, a detailed explanation of Anumana Jnaya Bhavas is there. So that the Mano Buddhyadi Vibramshavat, the how to examine is mentioned. Then he adds how to understand these small points. Then after Agni Jana Shakya, Agni Jana Shakya, Parisheta, Balam Vyayam Shakya, after 2-3 examinations, then continuously examination of Mana or Mano related faculties are mentioned. Mano Artham Avyavicharena, Vijnanam, Vyavasayena, Rajas Sangena, Moham Avijnanena, Krodham Abhidrohena, Shokam Dainyena, Harsham Amodena. So all these points, if you go through, if you understand these points, then this can be applied in the psychiatric patients. So, Dhairyam Avishadena, the patient appears dull, then you can say patient is not having any sort of courage. So, Bhayam Vishadena, patient appearing dull, and he is suffering from some sort of fear. There may be n number of years. So such things you can examine along with the Mano Buddhyadi conditions or in support to that. So these are the things which you have to adopt in psychiatric patients. Not only in psychiatric, some are in general patients or in the other patients also comes, but specifically these Anumana Jnaya Bhavas. Because it is Anumana, you are not seeing him. You are assuming by his presentation or his attitude, his question and answers. You are assuming this. Okay, so this you have to apply in examination. All these factors, maybe some 32 factors are mentioned, which are in relation to the Mano Buddhyadi examination. Okay, these are supportive factors. By Anumana, you can examine, a complete examination can be done with the Anumana only, because there is no other examinations. Pratyaksha, you are seeing the patient, but by Anumana, you can assume, see, the patient sometimes smiling is good, but always, every minute if he smiles, then you have to something wrong with him. That question comes, is it not? Once smiling is okay. If I smile to Dr. Uday Shankar sir, that is fine. But if continuously I smile, then see that is what Anumana Jnaya Bhavas application is. Okay. So if you understand these Anumana Jnaya Bhavas, okay, complete psychiatric examination can be done. Okay. So then coming to the Chikitsa aspect. See here, as already discussed, Doshaja Unmadha and Agantaja Unmadha, two aspects are there. Even in the Doshaja Unmadha, so whole whatever the modern psychiatry tells, that everything can be incorporated under this Unmadha chapter. Okay, everything, Unmadha and other combination. And this, because Apasmara as a separate entity, it is mostly specifically the neurological conditions along with psychiatry is mentioned there. So that is Apasmara. But in Unmadha, everything, whatever mentions in psychiatry, that classifications, DSM or ICD classification, that everything can be incorporated here. And because there it is only classification is there. Treatment, you come to the treatment questions? No, there is no treatment in modern. It is only suppressing the mind. But what we are doing, Sattva, Avajaya. You have to uplift the mind. But what the modern does is just giving anxiolytics, antidepressants. There is no complete question of cure. Antipsychotics. What happens? For the family, okay, patient is silent, he is not violent now. But for patient himself, he has to take lifetime medicines, and if 1 or 2 days left also he become violent, he can't work. So this is what happens in the modern psychiatry. But a proper application of our concepts in the treatment, definitely, because maybe Dr. Suhas and others were there with us here, we had after proper analyzing some Vataja Unmadha, Kaphaja Unmadha or Pittaja Unmadha, because the Lakshanas are given. You need not have the modern knowledge to understand these conditions, because a proper set of this, if these Lakshanas are there, this is Vataja Unmadha, and these Lakshanas are there, if that are Pittaja Unmadha, and these Lakshanas Kaphaja Unmadha, or mixed with Sanipatha, that is also once again Asadhya Unmadha. That should be there in your mind. These three categories are Sadhya Unmadha, Doshaja Unmadha are Sadhya Unmadha, may be mixed. Vata Pittaja symptoms may come. You can't expect only Vataja Lakshanas. Sometimes Pitta Kaphaja Lakshanas may be there because of the Hetus, Nidanas. Sometimes Vata Pittaja Vata Kaphaja conditions may come. So mostly maybe if you to understand the mild depression, moderate depression, severe depression, that is Vata Kaphaja, Pitta Kaphaja or Kaphaja conditions, like that to understand. So such conditions, clinical presentations may be there. Whatever the modern symptoms or modern science tells, that symptoms, or whatever in our classics mentioned, that symptoms are almost only what is mentioned in Ayurveda is in Sanskrita, or what is mentioned in modern is it is in English. That is the only difference. Otherwise symptoms are mostly whatever mentioned in psychiatry or Unmadha chapter. Apart from that is nothing in the psychiatric symptoms. Okay. Every symptoms are mentioned here. In Unmadha, almost what is there in the psychiatry as a symptoms, every symptoms has come here. And misinterpretation of the symptoms is there in the text. It's what Hridaya Shunya. That is, there is no emptiness of the, there is emotional emptiness. There is detachment from the, it's not pravritti and nivritti detachment, which is mentioned in Dosha Vichaya. That is different. Here it is the detachment from the relationship. He can't understand his son or his wife or his friend. So that is the Hridaya Shunyata, that is emotional detachment. So such symptoms are there in Unmadha. Not the Unmadha, either as per the Vata, or you can say if the patient is more speaking, more wandering, dressing improperly, or with the different, nowadays it is a fashion, we can't see it is Vata Unmadha, because keeping the sun which we don't use regularly, that if some leaves, some type of flowers, if that is because nowadays in the fashion all this goes. But for Unmadha we mentioned as symptoms, because generally we don't do. Is it not? In the fashion that is different. You can't consider that Unmadha that. Okay. And when the patient is more aggressive, Sambrambha, Arbhati or Himsraka, this is Pitta Lakshanas. And then patient is more silent. There is no speech at all, no interest in any work, no interest in any food, and drizzling of saliva. These are Kapha Lakshanas. So by seeing this you can say, this because Vata Pitta Kapha, these signs and symptoms very beautifully, mathematically, scientifically mentioned in our classes. So by this you can understand this is Vata Unmadha, this is Pitta Unmadha, this is Kapha Unmadha. And for that treatment also, because the Yuktiyopashraya line of treatment is highlighted in these Unmadhas. Unmadam Vataje Purvi Sneha Prayoje. So first line of treatment is Yuktiyopashraya or Vataje Unmadha, it is Sneha. And in Unmadha, you should not forget Vata specifically, or in all Manasika Vikaras, Vata. In the Vata Kaliya Adhyaya, what is mentioned in Vata? Vayustantra Tradaraha. Then Pravartakaha Chestana. So all your attitude or behavior are controlled by Manas. Manas is controlled by Vata. So in the treatment, you should not forget Vata, specifically Manasa Roga. Okay. Without Vata, there won't be anything in the disease formation. Pravartakas Chestana Uchchavachanam Niyanta Praneta. He controls, Vata controls the mind as well as Vata Praneta cha. Niyanta Praneta cha Manasaha. So, all our activities are controlled by Manas, and that Manas is controlled by Vata. And all our activities are because of the Manas, and that Manas is controlled by Vata. So, you should not forget this relationship in treatment also. So, while reading, it may be Kaphaja Unmadha or Pittaja Unmadha, Vata should be there in your mind. Okay, that's why even in the Chikitsa also, had not forgot Vata in the treatment. That's why in Chikitsa of Unmadha, mostly Sneha Upakramas you get. It may be for Pitta or Kapha. Sneha, either in the form of Ghrita preparations or Taila preparations also, which is mentioned in Avasthanusara Chikitsa, that can be applied in the Unmadha, or Amrutadi Taila etc. are there, which is mentioned in the Unmadha for internal as well as external. So, he had not forgot Sneha here, because Vata is the main or controller of Manas. So that Vata can be treated by which one? Sneha. Though the other treatments, Basti for Vata is there, but for Pitta Virechana is mentioned, for Kapha Vamana is mentioned. But in all that, once again, the Sneha is mainly used or prescribed in Unmadha and Apasmara. Okay, because Vata is the main culprit in all Manasika Rogas. That's why Snehana or Sneha Prayoga is mentioned even in Paitika Unmadas and Kafaja Unmadas too. Okay? So, then Agantaja Unmada. As already mentioned, Agantaja Unmada, that to be treated, Daiva, Vyapashraya, Yutyapashraya and Satvajaya. But Yutyapashraya line of treatment is very minimum there. But Daivyapashraya and Satvajaya is once again main line of treatment. But Charaka, you say it that Buddha Desham Vayat Sarnyam Dosham Kalam Balabale Chikitsa Vidam Kurya Unmade Bhuta Doshaje. Buddha Desham, without knowledge of Desha, the Agantaja Unmada should not be treated, because sometimes what you think is normal here may not be normal in other places. If you go to some foreign countries, the attitude of person appears some abnormal to you, but it is normal to them. So you can't consider that as abnormal. So that's why that Desha, knowledge of Desha, region, and the culture of that particular religion or region is most important while considering the Agantaja Unmada or Unmada. Okay, in Unmada, Desha, region, culture of the culture, food, dressing habits, all these. Sometimes you feel, what is this odd dress you had put? Is it mad? But it is his culture. The eating style. With 2 spoons. This is what he is mad. No, this is his culture. So that you should know. That is why Buddha Desham, most important. The culture of, while treating the Unmada patients, the culture of all, from where he comes, what is dress, what is food, what is attitude, all these are most important. Buddha Desham, Vayaha, according to age also, because sometimes aggressiveness is there in the which age group? Your age group. But then becomes, when crosses 40, all the aggressiveness will go, because Sarva Samsara Dukkha Hetutvat. Okay. Because everything is other combination. Because whatever I think, if that is right, that means I am having some other combination. Okay. So everybody thinks that I am right. See, other combination. Okay. So after 40, that all the aggressiveness will go. So that's why Vaya is most important. And then once again in the 80, the mentality of the people is different. So that age group you have to consider. So at this age group, at this particular age, what his behavior or speech etc. is normal or not. Buddha Desham Sarnyam. So Sarnya is a big concept once again. So understand Sarnya. Sarnya is not simple, it is accustomed to him. It may be so many Sarnyas are there. So maybe that particular food, that particular attitude may be Sarnya to him. So you have to consider that also. Then Kala, Dosha, Bala Balai, the strength and capacity or weaknesses of the individual. Chikitsita Vidam Kuryat Unmade Bhutadosha. So by considering all this, then you have to consider this is Agantaja Unmada, and in that you have to apply treatment. And in the treatment once again Agantaja Unmada, While considering Aganthuja Unmadha itself, he mentions why this Aganthuja Unmadha. Charaka had also questioned that. Is some Deva, Rishi, Gandharva, etc. interests you? But people usually tell, no? ಗಾಡಿ ಸೋಂಕಾಗಿದೆ, ಅವನಿಗೆ ಪಿಶಾಚಿ, ಬ್ರಹ್ಮರಾಕ್ಷಸ ದೋಷ, ಪಿಶಾಚಿ ಹಿಡಿದಿದೆ, ಪ್ರೇತ ಹಿಡಿದಿದೆ. Commonly people will tell. They have knowledge of that. Bhutonmada knowledge is people so have more than us, and they will take to that particular places also. Here Ukkudaga is there. If you go on particularly Amasya, thousands of people who are having this problem will be there, and they get treated also by taking bath in that particular river and doing the puja in that particular Gaduge of Ajja. Patient will come all right. Not all, but many are all right. So the Aganthuja Unmadha, that treated with Deva Prashadar itself, the people they take to that. They do the holy dip and patient become all right. So Aganthuja Unmadha, once again, how to consider this as Aganthuja? So he had doubt and clarified. Naiva Deva, na Gandharva, na Yaksha, na Rakshasaha. So there is no question of Yaksha, Raksha, Rakshasa, etc. This is the name has given by their attitude. By their behavior or attitude, this name to that particular symptoms has been given. This is Daiva, this is Rakshasa. It is behaving like Rakshasa, Rakshasa. It is not Rakshasa entered him. His attitude or behavior is like Rakshasa, and his behavior is like Deva. Prasanna, Chitta, Prasanna, Mana, Prasanna Mukha, and telling all the good things. Deva. Gandharva, fond of music, dancing, wandering here and there with different colored shirts or dresses. This is Gandharva. So like that, the name has given by seeing their attitude. There is no question of the Rakshasa entered or Deva entered, or it is Atmanaveva Matniyeta Kartaram Sukha Dukkha Yoho. The person, he himself, is responsible for all his Sukha and Dukkha. No, even in the Sushruta he explains that in the Darpana, how you are not entering into the mirror, is it not? Only your, what is? Chaya is entering. So you are not entering, but you are seeing your face there. In the same way, it is not the Rakshasa or Deva or Gandharva entering you. You are seeing your mirror as that. You are seeing yourself as Deva, yourself as Rakshasa, Gandharva. So, for that, the treatment is mentioned. Okay. So, that again comes the Rati and Archana Kamshi are treatable. You can treat them. Whereas, Himsra Kamshi, Rakshasa, Brahmarakshasa, Preta, Pishacha, difficult for the treatment. And okay, once again he mentions in Daiva, Gandharva, Yaksha, you should not do any krura karmas. What are krura karmas? Vadha, Bandha, Trasana, Agni karma, Vidya karma, Tishna, Anjana Prayoga, which is mentioned in Unmadha. That all are contraindicated there. You should not do any of these, because see, Deva is good to the society. He is telling your future. He is telling what you can do in the future. So then what is the question of this treatment? So specifically for the devas, no treatments are given. Nowhere. You can see the Devi is entering, coming and telling good to or blessings for all of you, and the Hanuman is entering or blessing, telling all your futures, solving your problems, or in the form of that is nowadays 6 cells etc. mentioned. So that is there. So Deva, no treatment is required. Gandharva is also not harmful to the society. He himself wanders with the different colored dresses, hearing music. Then what is the question of treatment? Not required. Yaksha also like that only. Where treatment required is to the remaining grahas, specifically remaining Unmadhas. Where Brahma Rakshasa, Rakshasa, Preta, Pishacha, Asura, these are but they are intreatable.